Hi, I'm Charlotte Moser, the co-director of the Vaccine Education Center at Children's Hospital of Philadelphia. And today on VEC Vaccine Notes, we're going to be talking about all things anthrax. In 2001, shortly after the September 11th attacks, anthrax spores were mailed to several prominent people in the government and in the media. 22 people were infected and 5 died. This incident demonstrated something that public health officials have long known about anthrax, which is that it could be used for nefarious purposes as a bioweapon. In today's episode, we'll talk about what makes this pathogen suitable as a bioweapon, and we'll also talk about what typically causes the sporadic cases that we see each year in the United States. We'll also talk about what area of the United States is more prone to having these cases, including where you can find the anthrax triangle. As in other episodes, we're going to talk about anthrax disease, including the 4 different forms of this disease that occur. We'll also talk about the vaccine and common questions we receive here at the Vaccine Education Center, as well as the relative risks and benefits of this vaccine. So let's get to it. Anthrax is caused by a bacteria known as Bacillus anthracis. The spores live in the soil and spread to animals that eat grass. Animals like sheep, cattle, goats, camels, antelopes, and deer. People are most often exposed to anthrax when they come into contact with those infected animals or with animal products that are contaminated with this bacteria. Importantly, anthrax is not spread from person to person. There are 3 main forms of this disease that depend on how the person is exposed, and I'll also talk about a 4th form that occurs much less frequently. Let's talk about the 3 more common forms of anthrax first. The most common type of anthrax is called cutaneous anthrax, and that occurs when people come into direct contact with the bacteria, which either enters their skin through cuts or wounds, or because they're handling contaminated animal products like meat, wool, hides, leather, or hair products. When somebody's exposed in this way, their symptoms usually start within 2 to 7 days after being exposed, and the most common first symptom is a sore that starts on their skin. Usually it starts as something small and red, but then progresses to a blackened, painless ulcer. Other symptoms that can develop after that include swollen glands, fever, being tired, having a headache. And about 1 in every 5 people will have trouble breathing. Some of them will develop a bloodstream infection that can be fatal, particularly if they don't get quick treatment with antibiotics. When somebody's treated with antibiotics in a timely manner, only about 2 of 100 people will die from this form of anthrax. The second type of anthrax is called gastrointestinal anthrax, and that results from eating contaminated meat. Like with cutaneous anthrax, the symptoms tend to develop between 2 and 7 days after exposure. But in this case, the symptoms often vary based on what part of the person's intestinal tract is affected. The range of symptoms can include things like fever, chills, swollen glands, sore throat, difficulty breathing, nausea, vomiting, diarrhea, stomach pain, or a flushed face or red eyes. A third type of anthrax is called pulmonary anthrax, and this form results from breathing in the spores of the bacteria. Now, people who have this form can experience a variety of symptoms, including chest discomfort, coughing, confusion, nausea or vomiting or stomach pain, sweating, dizziness. And this is the form that would most likely be used if anthrax was used as a bioweapon. And that's because even with treatment, about 4 or 5 of every 10 people that are infected by this route will die. A terrorist attack of this type could quickly result in mass casualties because it would be easy to spray a wide variety of these spores in the air, which a large number of people could inhale, and then they would very quickly develop symptoms and all need rapid treatment in order to be able to have any chance of surviving their infection. Now, the United States has prepared for this possibility. They have developed response plans, and they have materials stockpiled like medication and vaccines in the event that such an attack would happen. Let's hope we never need to use those stockpiles. Now, I mentioned that there was a fourth type of anthrax, and it's extremely rare, but it has been identified as another potential route for exposure. This type is called injection anthrax, and it occurs if heroin that's contaminated with spores of anthrax are injected. It's thought that this can occur if heroin is wrapped in animal skins during transport, or if animal products that contain anthrax spores are used during the making of heroin, such as bone meal. Because this type has occurred so rarely, the exact source of the contamination remains uncertain. But typically when cases of injection anthrax have occurred, the individuals involved have experienced things like swelling at the injection site, nausea, vomiting, and sweating. And they also tend to develop severe lesions that involve the skin surrounding the soft tissue that's near their injection site or the muscles near that site. Anthrax doesn't occur very often in the United States. At the beginning of the 20th century, there were about 130 cases per year, but improvements in both testing as well as handling of animals and vaccination of livestock have all dramatically decreased the number of cases in the United States. Between 2006 and 2025, only about 10 cases of anthrax have occurred in the United States. And many of these have been in areas where the acidity of the soil provides a good environment for the survival of the anthrax spores. This area includes parts of Colorado, North and South Dakota, Montana, and Texas. And in fact, there's an area of 8 counties in Texas that are known as Anthrax Triangle, and that's because of these soil conditions that make the spores able to survive and therefore increase the chance for somebody to be exposed to animals that have been infected with this disease. Now let's talk about the vaccine. The anthrax vaccine is made in a way that's similar to the acellular pertussis vaccine, because like with pertussis, the disease caused by anthrax is not actually caused by the bacteria directly, but rather these harmful proteins that are released by the bacteria. These proteins are called toxins. So when the anthrax vaccine is made, the bacteria are grown in the lab, and then they produce these toxins that are released into the broth in which the bacteria are being grown. The scientists then take that broth, purify it to remove the bacteria and to purify the toxins, and then they kill those toxins with formaldehyde and use that as the vaccine. Because the toxins are killed, they're rendered harmless, and those killed toxins are known as toxoids. So this is another type of toxoid vaccine, much like we talk about with diphtheria, tetanus, and pertussis. Now, there are 2 approaches to vaccination against anthrax. People can be vaccinated before they're exposed, or they can be vaccinated and medicated after they've been exposed. Because anthrax is so rare, most people in the United States aren't recommended to get this vaccine. But there are 3 groups that can benefit from vaccination prior to exposure. That's because of their likelihood of being exposed to these bacteria. These include some military personnel, depending on where they're deployed, lab personnel who work with the bacteria regularly, and also people who are regularly handling animals and animal products that might be contaminated with these bacteria, such as veterinarians, some farmers, and people who work in slaughterhouses. Now, people taking this vaccine prior to exposure are recommended to get 5 doses that are administered by injection into the muscle. This is known as an intramuscular injection. After the first dose, the other doses are given at 4 weeks, 6 months, 12 months, and 18 months. And if the person remains at increased risk, then they can get either annual doses or doses every 3 years, depending on what their risk level is. Now, when people are vaccinated after an exposure, they only need to get 3 doses, but those doses are injected under their skin, not into their muscle. This is known as a subcutaneous injection. The second and third doses are given at 2 weeks and 4 weeks after the first dose, This is a shortened timeline simply because these people have already been exposed to this bacteria. If there was a mass casualty event and the vaccine was in short supply, this schedule may be changed even further in the hope of being able to protect as many people as possible. So again, hopefully we never find ourselves needing to do that. Some of what we know about adapting the schedule to protect against a bioterrorist attack came from a study that was published in 1962. Now, at that time, the vaccine was being tested in mill workers who were at increased risk for exposure to anthrax due to their jobs. Some of the mill workers were given this vaccine and others were not. The researchers found that about 9 of every 10 vaccinated people developed antibodies against anthrax. That's what they were using as their measure to see if the vaccine worked, because antibodies could tell them whose immune systems responded to the vaccine. It would have been unethical for them to intentionally expose these people to anthrax to see who was protected or not, because this disease is so fatal. However, a chance occurrence during this study helped the researchers to learn more than they thought they would, because there was an outbreak of inhalational anthrax that happened to occur amongst the people who were participating in the study. Of the exposed mill workers, 5 people got anthrax after breathing in the spores. And what the researchers found was that none of those 5 were in the vaccinated group. So that provided some additional information in the event that we would be exposed to anthrax during a bioterrorist event. Side effects from the anthrax vaccine are similar to those we would expect from other vaccines. Things like mild pain, redness, and swelling at the injection site. That happens in about 1 of every 10 people who get this vaccine. And about 1 of every 100 people will have more severe pain and swelling at the injection site. And then some people, a small number, maybe about 4 out of every 7,000, will experience some fever, chills, body aches, or nausea. Severe side effects like anaphylaxis are extremely rare with this vaccine. Now let's go over a few common questions we get here at the Vaccine Education Center related to anthrax. At one point, we were getting several questions about whether the anthrax vaccine caused a condition called Gulf War syndrome. So let's take a step back. Between 1990 and 1991, the United States military was deployed to Iraq for Operation Desert Shield, also known as the Gulf War. These soldiers were vaccinated against anthrax, and some of them developed a series of symptoms that came to be known as Gulf War syndrome. The symptoms for this included muscle pain, fatigue, and headaches. And because they had been vaccinated against anthrax, some people wondered whether those two things were related. So a study was performed to try to answer that question. What the scientists did was they took blood samples from vaccinated soldiers who did or did not develop symptoms of Gulf War syndrome. And what they found was that both groups of soldiers had similar numbers of people who had antibodies against anthrax. So this suggested that the vaccine didn't cause Gulf War syndrome. Another question we get is whether antibiotics can be used to treat anthrax. And the short answer to this is yes. The antibiotics that are commonly used to kill anthrax bacteria include penicillin, doxycycline, and ciprofloxacin. Now, sometimes this answer leads to a follow-up question, which is, well, if antibiotics can kill anthrax or treat anthrax, why do we give this vaccine to military personnel or other people? In medicine, the rule of thumb is that prevention is generally better than treatment. But beyond that, there are 2 specific and important reasons why we should try to prevent anthrax through vaccination compared with treating it via antibiotics. First, not all people who get antibiotics actually survive their infection, and the vaccine is safe. So vaccination removes the chance of the treatment failing. The second, and perhaps the more important but more nuanced reason, is that the antibiotics kill anthrax bacteria, but they don't kill the spores. So when we're thinking about a bioterrorist attack, for example, say on the military or for anywhere else for that matter, the spores could be released into the air and inhaled, We could treat people with antibiotics to prevent them from getting the disease, but because the spores wouldn't be killed, we would have to treat them for some very long period of time, weeks or months, maybe even longer. Because as soon as they stopped taking the antibiotics, those spores could potentially reawaken. This is known as germination. And when they reawakened, they could then cause disease in that person once they stopped taking their antibiotics. We don't understand enough about the longevity of the spores to know how long we would need to treat somebody with antibiotics to prevent those spores from eventually germinating. So you can see why, in this case of a bioterrorist situation, it would be better if we can prevent people from getting infected through vaccination rather than trying to make sure we have enough antibiotics to treat a whole series of people for a very long period of time and then not really understand exactly when they should stop taking those antibiotics. Finally, some people reach out asking us about why anthrax is considered to be a potential bioterrorist threat. We talked a little bit about this throughout today's discussion, but let's pull the ideas all together. Anthrax is considered to be one of the most dangerous and potentially lethal agents for a bioterrorist attack for three main reasons. First, the spores can easily be sprayed into the air, and with widespread distribution, a large percentage of the population could be exposed in a relatively short period of time. Second, anthrax spores are stable for a long period of time in the environment, which means we could have ongoing exposures. And third, when inhaled, the spores are very deadly. About 95 of every 100 people who inhale enough spores will die if they're not immediately treated with antibiotics. And depending on the quantity of spores they inhaled, their time from exposure to their development of symptoms could be very short, even as short as a day. So if you put all these reasons together, you realize that we could very quickly have our medical system overwhelmed. And for these reasons, we really need to hope that anthrax is never used as a bioterror attack on our military or on our civilian populations. Okay, let's finish up with a look at the relative risks and benefits when it comes to anthrax. Today we discussed that this disease is quite rare in the United States, but certain groups like the military, lab workers, and people who work with animals that are likely to be infected with this bacteria are at greater risk. We talked about the fact that the disease can occur in four forms: cutaneous, gastrointestinal, pulmonary, and on very rare occasions, injection anthrax, if someone injects themselves with contaminated heroin. We talked about the fact that the most common form is cutaneous anthrax, but the most deadly form is inhalational anthrax. We also talked about the fact that the disease is caused by toxins that are released during bacterial replication, but that the most troublesome aspect of anthrax bacteria is the hardy nature of the spores, which live in the soil and are particularly likely to live in certain soil types that are acidic, and that makes some areas of the United States more likely to have exposures to anthrax because the spores are in the soil in places like Colorado, the Dakotas, Montana, and Texas. We also talked about the fact that the vaccine is similar to the pertussis vaccine, both in the way that it's made in terms of being made of killed toxins known as toxoids, but also in terms of the side effects that one can expect, like pain and redness at the injection site, but with a small number of people getting more serious side effects that are systemic in nature, like fever, chills, and body aches or nausea. About 4 of every 7,000 people will experience those side effects. We also discussed the fact that people in the United States are generally not recommended to get this vaccine because the disease is so rare and because people can get the vaccine after exposure when it's coupled with antibiotic treatment, and that can be effective as long as the treatment occurs very quickly after exposure. However, there are a few groups who are recommended to get this vaccine, and that's because they're more likely to be exposed to anthrax. We think it makes sense for our military to be protected in the event of any kind of bioterrorist event, as well as people who are commonly have the chance to be exposed to this disease, such as people who work with animals all the time or farmers who are working with livestock that may be likely to be infected. We hope that after you've reviewed this information in light of your own personal situation, that you'll feel the same way as well. Thanks for listening today.